When is it safe to run after a shoulder injury or after a knee or foot or ankle injury? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I help athletes and active people like you feel and perform your best regardless of age or injuries. Now, running is an exercise that so many millions of people love to run. But after you hurt your foot or your ankle or your knee, or maybe it's a shoulder injury or even after surgery, you want to get back out on the road and put in those miles again. But when is it safe to do that? Okay, let's talk about that because I want to help you get back to that. But here's the thing. There's not an absolute right answer that applies to everybody. You're going to want to talk to your doctor about your specific injury, your specific surgery, and when it's safe. But here are some general rules of thumb. When we talk about going back to running, there's sort of a progression. It's just not, 3 weeks out you're cleared to run. It doesn't really work like that. With an injury, say of the foot or the ankle or the knee, when you're allowed to start walking on it, I usually tell people, all right, when you can walk on it and you can walk comfortably, not in a boot, not in some sort of cast, but you can walk in normal shoes and you're not limping and you're not having really uncomfortable pain, then you can try out jogging. And you're going to start out with really short distances, maybe a quarter mile or a half mile, and see how it feels. Not just right then, but even see how it feels the next day. What you don't want to do is run and this doesn't feel so bad, and then the next day it's swollen up like a basketball and it sets you back 3 or 4 days. So just a short period, and if that day and the next day it feels fine, then maybe go a little farther the next day and a little farther the next day. Then increase your distance and increase your speed and increase your intensity until you're back where you want to be. Again, after surgeries where there's periods of non-weight bearing, there may be different restrictions, but it's when you can start weight bearing, that's the general progression. When you can walk normally in no boot or cast or anything like that, but in normal shoes without pain, then you can start trying out jogging. Now, you think, well, upper body, there should be no restrictions, right? Because there's no impact on the shoulder or on the elbow, and that's generally true. Most of the time you can run. But after a shoulder surgery specifically, there's a couple things at least to think about and talk to your doctor about. One, you want to make sure you don't fall. And I know you don't plan on falling, but your foot trips on something and your shoulder doesn't really move like it normally does because you just had surgery. You don't want to potentially fall on it or fall on your outstretched hands and potentially make that problem worse. But the other thing I hear from patients when I do rotator cuff repair, labral repair, or something like that, is that just the bouncing of running and hitting that pavement just doesn't feel that good on the shoulder because of the surgery done. So you may try other types of exercise, stationary bike, elliptical, things that don't involve repetitive pounding until that shoulder is a little farther out. Again, talk to your doctor because there's all kinds of variability, but those are just a few things to think about. If this was helpful, definitely click the video below for other helpful information about injuries and returning to sports and exercise. And if you like these types of things, subscribe to my video channel. I look forward to seeing you right here next time.